Shoulder impingement. How do you fix a shoulder impingement? Shoulder impingement. When it comes to shoulder pain, there are a variety of conditions that could be responsible. One common culprit is shoulder impingement, a condition where the tendons and bursa in the shoulder become compressed and inflamed. Causes of shoulder impingement. Shoulder impingement can occur when the space between the top of the shoulder blade and the rotator cuff, a group of muscles and tendons that attach the shoulder to the upper arm bone, narrows. Overuse, repetitive overhead movements, such as those performed by athletes, construction workers, or painters, can lead to shoulder impingement over time. Aging. As we age, the tendons in our shoulders can become less flexible, making impingement more likely. Structural issues. Certain anatomical variations, such as a hooked acromion, the bony projection at the top of the shoulder blade, can make impingement more likely. Symptoms of shoulder impingement. Pain in the shoulder. This pain may be felt deep within the shoulder or on the outside of the arm, and can be exacerbated by overhead movements. Weakness in the shoulder. You may notice that you have difficulty lifting objects or performing tasks that require arm strength. Limited range of motion. You may find that you can't move your shoulder through its full range of motion without pain or discomfort. Shoulder stiffness. You may feel that your shoulder is stiff or difficult to move, especially after periods of inactivity. Tenderness or swelling. The affected area may be tender to the touch, and you may notice swelling or redness around the shoulder. If you're experiencing any of these symptoms, it's important to see a doctor or physical therapist to determine the underlying cause of your pain. How to diagnose shoulder impingement. Shoulder impingement can be a painful and frustrating condition, but before you can begin treatment, you need to understand what's causing your symptoms. The first step in diagnosing shoulder impingement is to discuss your medical history and symptoms with your doctor. They may ask you questions about when your symptoms began, what makes them better or worse, and whether you have a history of shoulder problems or injuries. They may also ask about your occupation, hobbies, and sports activities to get a better sense of the types of movements you perform regularly. Imaging tests. If your doctor suspects that you have shoulder impingement, they may order imaging tests to confirm the diagnosis. These may include X-rays. X-rays can help your doctor rule out other conditions, such as arthritis or fractures, that could be causing your symptoms. MRI, magnetic resonance imaging, MRI, can provide a detailed view of the soft tissues in your shoulder, allowing your doctor to see if there are any abnormalities or damage to the tendons or bursa. Ultrasound. Ultrasound is a non-invasive imaging test that uses sound waves to create images of the inside of your shoulder. It can be helpful in diagnosing impingement and assessing the severity of the condition. Treatment and next steps. Physiotherapy for shoulder impingement. If you want treatment, then you can consult on our WhatsApp + 923,450,664,731. Shoulder impingement can be a painful and frustrating condition, but with the help of a qualified physiotherapist, it's often possible to manage or even eliminate the symptoms. Goals of physiotherapy for shoulder impingement. The goals of physiotherapy for shoulder impingement are to reduce pain, improve range of motion, and strengthen the muscles and tendons in the shoulder. Your physiotherapist will work with you to develop a customized treatment plan that addresses your specific symptoms and needs. Treatment techniques. Physiotherapy for shoulder impingement may include a variety of treatment techniques, such as manual therapy. Your physiotherapist may use hands-on techniques to manipulate the soft tissues in your shoulder, helping to reduce pain and inflammation. Exercise therapy. Exercise therapy can help to strengthen the muscles and tendons in your shoulder, improving stability and reducing the risk of further injury. Modalities. Your physiotherapist may use modalities such as heat, ice, or ultrasound to reduce pain and inflammation. Education. Your physiotherapist will work with you to educate you on proper posture, body mechanics, and techniques for performing activities of daily living without exacerbating your symptoms. Home exercise program. In addition to an office treatment, your physiotherapist may prescribe a home exercise program for you to follow between appointments. This may include exercises to improve shoulder range of motion, strength, and stability. Recovery timeline. The recovery timeline for shoulder impingement can vary depending on the severity of your symptoms and the extent of your injury. However, with proper physiotherapy treatment and diligent adherence to your home exercise program, many people are able to recover within a few months. Conclusion. If you're experiencing shoulder pain or weakness, physiotherapy can be an effective treatment option to help you manage your symptoms and prevent further injury. By working closely with a qualified physiotherapist and following their recommendations, you can take control of your shoulder health and get back to doing the activities you love.